This presentation is on a proposed study examining the physical health outcomes among Black youth from low-income households in Toronto, presented by Angela Bruce. This presentation will begin with introduction, followed by the background, objectives, methods, statistical issues, ethical issues, limitations, summary, and references. The research question is, in Black youth aged 15 to 24 living in Toronto, how does coming from a low-income household affect one's physical health outcomes compared to white youth from high-income households? According to the Government of Ontario, low household income is a family net income below 82,500. Individuals on government financial assistance will also be considered as individuals on governmental financial assistance usually are required to have a low income in order to qualify for such supports. Physical health outcomes will be classified as diabetes, high blood pressure, gastric diseases such as those caused by H. pylori, and respiratory illnesses like asthma. Black Canadians are disproportionately affected by educational, structural, and institutional obstacles. According to the Canada Public Health Agency, Black Canadians have double the prevalence rate of diabetes than white Canadians. Although research has been conducted to identify how social determinants affect Black Canadians, current research on Black youth in Toronto is very scarce, and there is a gap in research on how the social determinant of low income status directly affects the physical health outcomes of Black youth in Toronto. Research shows that the impact of systemic racialization endured by Black individuals leads to low income, poor health, and low employment rates. This further necessitates the need to explore the relation between low income and physical health outcomes of Black youth in Toronto. A literature review was done to examine the available studies that discuss the impact of coming from a low-income household and its effect on the physical health outcomes of Black youth in Toronto. A study was done to examine the prevalence and risk of diabetes among African, Caribbean, Black, also abbreviated as ACB, individuals aged 18 to 39. A mixed method approach was used in this study. There is a high prevalence of diabetes in the Black community, thus this research aims to identify factors that predispose ACB individuals earlier on. 8.5% of Black individuals residing in Ontario reported having diabetes. This is twice the rate observed in white individuals. 44% of participants were at risk of developing diabetes, justifying the need for further research. This study revealed that the universal percentage to determine whether an individual is prediabetic is not a comprehensive approach. A value of 5.7% on the HbA1c test would accurately diagnose prediabetes in ACB individuals, rather than the standard 6.0 to 6.5%. A strength noted in this study was that it highlighted the need to consider cultural relative equity focused parameters for ACB individuals to diagnose prediabetes and other diseases. A limitation noted was the small sample size, which hindered generalizability. A 2-year randomized controlled field trial study of Housing First, which delivered stable housing, reported an increase in community involvement among participants. It incorporated an anti-racism and anti-oppression approach to improve the outcome of Black and ethnic minority participants. The study further necessitates the value of cultural adaptation for individuals who are at great disadvantage, highlighting the need for future research on anti-racist and anti-oppressive incorporation to the usual Housing First services. This underscores the importance of comprehensive research to create effective services to address homelessness and issues faced by minority groups. Services need to be altered to meet the needs of the marginalized groups. A strength noted was that throughout the Housing First initiative, the study was also expressed that culture-centered behavioral interventions result in better health outcomes. A limitation noted was that participants failed to have improvements in the reduction of substance use. A study explored the needs of the LAMP Community Health Center, abbreviated as LCHC, located in South Etobicoke. 3 focus groups were organized and it consisted of 5 housing complexes. The objective of the study is to evaluate the needs of individuals or residents living in low-income neighborhoods in Toronto. The snowball effect was used to recruit participants. However, since the study became no longer feasible due to staffing issues, the goal was changed to an academic research inquiry. The findings explained gentrification hindered marginalized individuals from taking part in recreation services. Marginalized residents also face difficulty accessing transportation, which can lead to food insecurity, compromising an individual's health outcome. This highlights the issue of lack of affordable housing and the quality of Toronto community housing, which has impacted residents and caused asthma allergies. The study highlights the exposure to racism and discrimination as it increases the risk for cardiovascular disease, elevated blood pressure, and mental health problems. The study was conducted by 4 individuals from white middle-class backgrounds, which could influence the interpretation of the findings and conclusion reached, and can be seen as a limitation. However, the LCHC trusted their compassionate abilities. A study explored the specific ways in which a global pandemic disproportionately affects the mental health of Black youth. While my study focuses on physical health, there is a lack of available literature on physical health. Thus, I decided to explore mental health to better understand how systemic barriers influence the mental health of Black youth. This study used a community-based participatory research design. Participants were recruited through advisory committee members and networks of Black youth co-researchers. 48 Black individuals were interviewed between the ages of 16 and 30. In Canada to understand the unique challenges faced. Unhealthy household environments, lack of support to access resources, financial burdens, and food insecurity worsen mental health challenges. Black individuals are more at risk of adopting harmful coping mechanisms and unhealthy lifestyle choices, leading to cardiovascular disease and cancer. However, the study explained that children who experience stressors early on in life are at risk of long-term adverse health outcomes and unlikely to present them until adulthood. The strength of the study was that the overall goal of the study was achieved, to establish the transferability of findings to inform policy and regulation to support Black youth in Canada. A limitation noted was a lack of representation, mainly amongst Black youth in general and those involved in the justice system or who are out of school and work. A study was conducted where quantitative data was collected through focus groups. The findings revealed that young males in Malvern demonstrated a lack of knowledge of health issues. Generally, the findings from the young males, refugees, and females expressed that health education came from physical education teachers or from the internet and friends. They also admitted their lack of trust in healthcare professionals and the experience of feeling unheard. Although the study is dated, the lack of new studies found on how low-income status impacts the physical health outcomes of Black youth in Toronto showcases the need for further research. The strengths identified are open discussion, and the focus groups fostered that. Alternatively, this can be viewed as a weakness, as it may influence a consensus and hinder varying opinions. In conclusion, the literature review revealed that low income can contribute to a higher risk of physical health conditions and chronic diseases. Cultural and systemic barriers heighten health disparities faced by racial groups. Targeted health education and structural initiatives are required to combat this issue. The gaps in knowledge were limited research on physical health outcomes in Black youth in Toronto, lack of generalizability, inadequate focus on Toronto-specific data, and the need for culturally appropriate education and diagnostic parameters in Black youth. The main goal of this study is to determine how low income impacts the physical health outcomes of Black youth in Toronto and to create social services that would not only aid Black youth in Toronto but support them throughout their adulthood and navigating barriers. A retrospective cohort study will be useful along with information from government and hospital databases shared with the public. Analysis will be conducted on the health conditions of Black youth in Toronto admitted to a hospital with a physical disease. Researchers will identify the neighborhoods they belong to and income status of those areas. Using a cross-sectional study, an evaluation will be conducted of a group of Black youth living with low income status and physical diseases, comparing them to white youth with high income status and physical diseases. Similar studies were found, however, that were conducted using focus groups. The inclusion criteria include Black youth aged 15 to 24 in Toronto with physical diseases, Black youth in Toronto who currently come from low-income households or have lived in low-income households for at least 5 years, white youth aged 15 to 24 in Toronto with acquired diseases, white youth in Toronto who lived in high-income households or have lived in high-income households for the last 5 years. Disease/health conditions must be non-genetic. Youth must have developed disease post-birth. The exclusion criteria is Black and white youth born with a disease or have a genetic disease, white youth with low-income household, which is less than 82,500, Black youth with high-income household, which is greater than 82,500, age 14 and below, or 25 and above. Participants will be recruited through community organizations, so during events, flyers will be posted and booths will be made available to individuals within the Black and white community. Flyers will also be posted in gyms and also in community housing. Posters will also be placed in colleges and universities. University student associations will be informed to make students aware of their study taking place. There will also be online access so students can pause and resume, and there will also be reminders reminding them to complete the questionnaire. Through peer recruitment, participants will be encouraged to share the survey with 3 individuals to receive an incentive of a $10 gift card. The exposure variable will be on a nominal scale. The question will be a yes or no question. Participants will be asked if household income falls below 82,500 annually, which is considered the low income for this study. The outcome variables will be on an ordinal scale. Individuals will be asked questions on their medical history, like diabetes status, blood pressure, gastric disorders, and body mass index. The study aims to facilitate reliable and accurate results through the use of valid measurements to assess health outcomes like blood pressure readings and participants' medical history. Researchers will explain the questionnaire to participants in detail and analyze results in non-biased ways. There will be adequate time to complete the questionnaire and gather required income and health information. Strong validity associated with health data from hospital databases and categorical data ensures all income levels and health outcomes are accounted for. The exposure variable will be income level and it will be nominal. The statistical test will be a chi-square test. A chi-square test can be used by researchers to compare the proportion of Black youth from low-income households who develop physical diseases to the proportion of white youth from high-income households who develop the same diseases. The chi-square test would assess whether there is a statistically significant difference in these proportions, helping to determine if income status influences physical health outcomes within these groups. The analytical approach would be to measure between the low income and physical health outcome in Black youth in Toronto. Hypothesis is Black youth from low-income households will report poorer physical health conditions than white youth from high-income households. Or the alternative hypothesis, Black youth from low-income households will not report poorer physical health conditions than white youth from high-income households. This study will adhere to the Tri-Council policy statement through respect for person. This research aims to help Black youth address the impact of low income status on their health. Underage participants are required to have parental permission. Individuals will be able to express how they feel freely without interference or persuasion, and in an anti-oppressive environment with a trained counselor. To protect the welfare of participants, the questionnaire will be anonymous. Informed consent is required as the research will involve financial and health data. Participants will also have resources available for counseling if reflecting on financial struggles and health difficulties may be triggering and evoke feelings of stress and anxiety. This research will also ensure justice by using trauma-informed counselors to explain the questionnaire and prioritize patients' well-being. Transparency will be maintained by sharing results, explaining the research aim, and offering opportunities for feedback. The study will also adhere to the Research Ethics Board principles through informed consent process, reducing potential harms to patients, and not enforcing stereotypes and ensuring privacy and confidentiality of participants. When conducting this study, some categories may have low frequency, thus it's important to ensure low frequency categories are joined together. Researchers can also aim to collect more data on categories with low frequency. Confounding variables may be a limitation, however, stratifying this data into age and gender can help better assess the impacts of income and health as it pertains to age and gender. Insufficient information regarding income status or low participation resulting from a lack of trust or interest and absence of reliable responses can impact the study. To combat this, researchers and counselors must be educated on methods to foster trust, therapeutic communication, and the ability to explain the importance of the study. Ensuring participants can pause and resume the questionnaire gives them the time to find accurate, reliable information, and reminders will be set for them to complete the survey. In summary, results will be used to implement helpful strategies to ensure Black youth from Toronto are able to live healthy lives despite income status. Also, by eliminating financial constraints, youth can focus on prioritizing and managing their health, equipping them to build successful futures, and establish culturally appropriate education and diagnostic parameters for Black youth. The presentation below I have the references listed. Thank you.